discussed on this podcast are determined by the JUSTus Coordinating Commission of the Sisters of Providence of St. Mary of the Woods, Indiana. Guest opinions do not necessarily reflect those of the Sisters of Providence. To learn more, go to www.spsmw.org.
Welcome to Just Us, where we talk about creating an equitable human community and influencing change. Through shared stories, conversation, and inspiration, you will learn how Just Us can make a difference in our communities. I am Jane Fisher, your host for today. I'm a Providence associate, and I'm coming to you from Southern Indiana and a little town called Jasper. In today's episode, I would like to introduce our guest, Dana Simons, Executive Director of Next Step, who is joining us in this shared space to discuss addiction and the impact of the big, beautiful bill. Dana, where are you joining us from? And please tell us a little bit about yourself.
Well, thank you, Jane. I'm joining you from West Central Indiana, in a little town called Terre Haute, famous for Indiana State University and Larry Bird, kind of our claim to fame. And
Yes.
Clabber Girl. Clabber Girl is also here. I've been working for the last 15 years in the behavioral health world of addiction, substance use disorder. Prior to that, I spent about 25 years in the software industry in California and in the state of Washington.
The mission of the program that you have there, go ahead.
Yeah, the mission of we have a nonprofit, faith-based residential recovery community. So we provide multiple levels of service from residential inpatient all the way to outpatient, to recovery support services, to childcare, to housing. So we've built a recovery community. And our mission is to love the ones that God sends to us and to promote a safe and healing environment where they can find a whole and healthy lifestyle that they so desire to have.
You said something there I didn't understand. Support services or support services? Support services,
Yeah.
My fault. Okay.
Yeah, recovery support services, which are things like peer coaching and sober social events and a recovery cafe and all of the things that people need to recover from substance use disorder outside of just being treated for it from a treatment standpoint. It's more of community-based services, and we provide all of that.
Do you do that all at that one location there in Terre Haute?
Well, we have we're in a neighborhood, and in this neighborhood, which is Farrington's Grove, it's a historic district. We have one main building, which is a 1895 Presbyterian church with 28 stained glass windows and a pipe organ.
Oh.
Just a beautiful, beautiful location. And around that, God has been kind enough to have neighbors give us their homes. There are a lot of older 150-year-old homes, but we have 7 homes, which are group living. And then we have 17 apartments now. We just opened up 9 apartments for pregnant and parenting women. So in this little neighborhood area, we kind of have a community within a community. We call it the Next Step community.
This structure, I understand the group living, group homes, but you said how many pregnant women you have there?
We have 9 apartments for pregnant and parenting women. So we've got a few women that have 2-year-olds and newborns, and we've got 4 pregnant women. And we've been doing this for 15 years. So we have a lot of Next Step babies that are now Next Step teenagers because they stay connected with the community, which is a key part to recovery, is making sure that they have connection. The opposite of addiction is not sobriety. The opposite of addiction is connection. And that's a quote by Johann Hari, but it's really true, is they need to be connected.
Once they are sober and working and functioning, they stay connected with you.
Correct. They move into transitional living, they move into apartments, and some of them go back home. Some of them have a home, they're coming from a rural town, and but a lot of them stay here because they can't go back because they come from an area that's very, very heavy in drug use. And if they go back, they'll just use again. So many we have about 100 people that are part of this community.
That's amazing.
Yeah, God has done an amazing thing.
Tell me a little bit, and then we'll move on, a little bit about the pregnant women who come. They are addicted when they enter?
Yes.
And
So
how do they get to you?
well, all we work a lot with the healthcare system. Union Health has an All Babies initiative. Sometimes what happens, what has been happening to us from the very beginning, because we started as a woman's program, is a woman that's pregnant wants to stop, but often she has another child at home or two children at home that are young, and she can't leave them to go get treatment. So what ends up happening is she goes to the hospital, she gives birth, they find out she's tests positive for drugs, they take the baby away, and now she's in a DCS case, and then she comes to us for treatment without the children, and the children are placed in foster care. So what we decided to do, one of the biggest barriers for pregnant women that want to quit, is there's nowhere to go that will take children. So we're pretty excited because we finally have been able to open, through grant funding, a pregnant and parenting women's campus where they can have an apartment, and then they can also, right on the same building, they have a wonderful child care center. So they can come to the
Oh,
classes right across the street. They can come see their therapist. The kids can be dropped off at child care, so they can be getting treatment and then not have to reunite with the children and put the children through the trauma of being taken from their homes. And mom can get the treatment she needs.
wow. Where do you get the
Pretty
funding?
exciting.
It is exciting. Where do
Well,
you get the funding?
the funding for that came from the National Opioid Settlement Funds, which were given to each state that joined the national lawsuit. And our state, the state of Indiana, the Department of Mental Health and Addiction, decided that they came up with very creative ways to meet needs like transportation grant, because that's a big issue. And then this was a grant, a capital expense grant, where you could build a building proving that you were serving an underserved community. So we were pretty excited to be able to be one of only four that were chosen to be able to get that funding in the state.
And other funding that you have.
The other funding, the main source of funding comes from Medicaid. So we've been doing this about 15 years. The first 6 years, my husband and I were just volunteers because we had very limited sources of resource. We had funds. We have 14 churches of various denominations that support us. We work a lot with Catholic Charities in order to supply food for our clients that live with us. And I went back to school to get my master's in social work in 2017. And that then allowed me to become a licensed clinical social worker and a licensed clinical addictions counselor, which then made me eligible to bill services under Medicaid. So
Oh,
that happened in 2017, 2018. And then we were accepted by Medicaid, which is no small feat because you have to go through so much paperwork. And Medicaid is the lowest payer of all the different insurance companies. But for us,
yes.
it was a huge amount of money because we were getting nothing, and now we could actually get. So now about 90%, 92% of our funding comes through Medicaid, through insurance services.
That's amazing. Tell me then, Dana, what happens under this, what they call the big bill, the big beautiful bill that's being proposed for our budget? What would happen to organizations like yours, like Next Step?
What would happen right now? I employ 42 people. 50% of those, 21 of those are actually certified peer recovery coaches. And what happens with Medicaid is there's an extension process that a lot of through Obamacare, substance use disorder is one of the 10 things that has to be covered by insurance. And then through the expansion of Medicaid, which expanded it from just disabled, the sickest of the sick of our community, to low income. So we expanded in the state of Indiana. And that allowed us, and we got a waiver, which means we can hire and Medicaid will pay for the services of people with lived experience. And they are so crucial to the whole healthcare infrastructure in addiction treatment because they give the hope and the experience and the strength to show people it can be done.
Excuse me, when you say lived experience, these
Yes.
people, go ahead and define these people.
These people have overcome an addiction or a mental health condition, and they are in recovery themselves. And so what they bring to the table is their experience, their strength, and their hope, which makes them extremely effective coaches. They go through training, they become certified, just like you would go through therapy training. They go through training they learn about motivational interviewing, they learn skills and techniques to work with people that are in recovery. They have special tools like Recovery Capital. So they're just an integral part of it. And if this big bad bill passes. The Senate bill is even worse than the House bill, because it changes the way Medicaid gets funded from the state and federal split. And it would force a tremendous amount onto the state budgets. And right now it's 90% federally funded. And that would mean for organizations like Next Step, and the majority of all behavioral health in this country is funded by Medicaid. And so you've got a lot of people at the lower socioeconomic end of the scale that are dealing with addiction, mental health, and the only way they get help is through the healthcare system. And so what it would mean for me, and the thing that I am most concerned about, is I could serve less people. I couldn't serve them with the amount of services that I have right now. I have 5 clinicians on staff so they can get mental health treatment in addition to sober living and recovery coaches and all the other support services that we offer. And I would have to lay off the majority of my staff, because again, that is our major source. And the way this bill is laid out is it's trying to put a lot of red tape. Not only is it changing the funding, which means the state would have to come up with that, which they don't have the money to do, but it also changes the way that they want to put work requirements in, which in Arkansas and New Hampshire have proven that all that does is cause red tape. Our people are working. It's not that they're not working. It's that they are going to have to prove that they're working. Or if they have 1 week with only 18 hours instead of 20 hours, then they lose their coverage. So it just puts another burden on them, which means less people are going to be covered, which means less people can be employed in my organization. And we would become, for all intents and purposes, we would go back to where we were, which is a volunteer organization. And that would be heartbreaking. All of the progress we've made in addiction, 27% drop in overdose last year nationwide, 23% in Indiana, because of all the work we've done. So it's just, and it will cause, you cut those people out, they can't have interrupted service. It takes 2 to 5 years to recover from addiction. So now you've interrupted their treatment, or you've interrupted the services they can get for their mental health condition, which typically is what underlies the addiction. You got a lot of bipolar, you got a lot of depression, you got a lot of anxiety, and they're taking pills to manage that. And so we have to address the underlying mental health component. And if we have no access to healthcare, how are they going to do that? Now we're going to have people going to the emergency room. We're going to have people dying. And we're not saving any money. We're not going to save money. It's going to cost way more, because now you've got the higher expenses that they're doing. So it's very, very, it's just not a thought out bill, and it's very cruel. That bottom line is it's cruel.
I've read also that there's concern about services in rural areas of the states, and that their hospitals. Go ahead.
We serve rural communities near our town of Terre Haute is about 65,000 people, but we have little tiny towns, Mecca and Attica and Sullivan, and lots of rural farming communities just outside of Terre Haute. So we have a Sullivan Recovery Cafe that we operate that's 30 minutes south of here, little town of 2,000 people. They have a hospital. Their hospital relies predominantly, again, 90% from Medicaid. So those rural hospitals would close. And when those rural hospitals close, it doesn't matter what your insurance is, right? The commercial insurance, it doesn't matter. You don't have a hospital. And so now I fear for the rural areas in terms of what their services that would be available.
Are you hearing fear among your community right there at Next Step? Are they aware of what's being talked about, your clients and your staff?
Good question. They're aware of it because we're talking about it with them. A lot of our people, most of the clients, we have for years and years, we've had a huge problem with methamphetamine in this area. It started because of the accessibility to anhydrous ammonia in the farming community. They could get that on the farms. And the methamphetamine epidemic, then we got the opioid epidemic that came on the heels of the methamphetamine epidemic. And in that process, most of our folks that we serve don't have a high school education. Most of the folks we serve their parents taught them how to cook meth when they were 10 or 11 or 12. So as far as understanding what Medicaid is, even understanding healthcare, when they get a job and they're being paid well and they have to get real healthcare, not Medicaid, we have to sit down with them and explain what a copay is and explain what a premium is and explain, because again, they're not familiar with that. So when we've been talking to them about what would happen if Medicaid was reduced in any way, and they very clearly understand, because half of the people that work here were on Medicaid, were addicted, and now have a real job, but they came from being on Medicaid. So they're very concerned. They're very aware of what this means for their jobs. And I think my biggest concern is these peer recovery coaches who we've integrated into the healthcare system in Indiana, where they're in the emergency rooms for overdose, and they're in the police departments, and they're throughout the healthcare industry in our communities. And only Medicaid pays for them. Commercial insurance doesn't pay for peer recovery coaches. And they have the requirement is a high school education and then go through the training course and pass an exam. So if Medicaid's gone, which means nobody can afford to hire them, hospitals can't hire them, we can't hire them. My real fear is, where do they go? Right? We are paying them very handsomely right now. I don't know where else they're going to replace that income and purpose, the sense of purpose they have, which keeps them sober, it keeps them productive. And now they're going to have to go flip burgers or something. So I'm very concerned about what this does to the peer workforce that we have built so diligently over the last decade, and what happens to their jobs.
Yes, and these are the daily walking examples to your clients.
Absolutely.
And it sounds like they develop very strong relationships.
Yes.
And then once your clients are ready to, I will say, leave next steps, like physically, but though they're still connected.
Take the next step.
Take the next step. Thank you. They still come back and still have those relationships.
Absolutely. That's one of those, the ideas in recovery is, again, it's a continuum. It's a 2 to 5 year journey. The way that you stay in recovery, and that's why AA is so effective. It's why, because you have a community, you have a fellowship. So we have the Recovery Cafe, which is open 3 days a week. We have sober social events. We have alumni events. They go camping. They go down the river. They do river rafting trips. They try to have recreation. And the most important thing is the community. So the cafe has a model of what they call cafe companions, where we have people from the community who just volunteer to have a cup of coffee, and just when you need, I call it a sober cheers. Sometimes you want to go where everybody knows your name and they're always glad you came. That's really what's the number one ingredient for recovery, is knowing that someone knows your name. And so we have things called recovery circles, connection circles, which are a group that gets together every week, same 8 people, just journeying in life together. It's kind of, one of the things we've lost in losing the local church, the fact that, like, our church that we work out of was a neighborhood church back in the turn of, it's 150 years old. And in 2011, they sold it because nobody was going to that church anymore. And we see that across the United States, so the dwindling of church attendance. But we're then losing the community aspect, that connection aspect. And isn't it interesting? We have a drug epidemic at the same time church attendance is going down. And so they're related. And so trying to have some kind of a parachurch ministry, a way that they have a place to go, is crucial for that long-term sobriety.
I have to take a breath. And I think our audience does too. You mentioned funding from, I'm going to use the word opioid, but that's not what you said when you were talking about methamphetamine. But I'm too ignorant to.
Opioid settlement money. It's when they sued all the pharmaceuticals that were handing out these pills. And
we're close to another settlement with that, right?
Yes, we are. There's another settlement that just got inked and this is multi-billions of dollars. And where they were really smart with the opioid settlement money is versus tobacco, when they got all the tobacco money, but it wasn't designated that it should be used for tobacco cessation. So cities took it and built new roads with it. But the opioid settlement funds were very specifically designated that they have to be used for treatment or prevention, or, so that is the one bright light, is that we will still have access to that money. Because the other thing this administration has done is really cut back all of the services that come from SAMHSA, which is the Substance Abuse and Mental Health Services Administration, which gives out so many federal grants, and they've been basically eliminated. So even at the federal level, we're losing a lot of money from grants, the grant side.
Well, and Dana, what I read, correct me if I'm wrong, was when we lose that money with this bill, then whatever money is coming in from this new settlement agreement will really have to be used to prop up the existing programs. So it's not really a gain. Is that right?
No, that's exactly right. So when I told you about the fact that we got the grant money to be able to build our pregnant parenting women's campus,
Yes.
if that money now, and it wouldn't even be enough to probably make up the gap, but if that money is now not available, you can't have these innovative programs. They would just try to be stopgapping.
So we're going to have to supplement existing programs with the new money instead of being able to be creative and do new programs. Is that correct?
That's correct. And that's going to be the stopping of innovation, right? So now if all we got to do is stop, the reason we've had such great success is because we have innovated. We've brought in peer recovery coaches. We started new programs. There's the Recovery Cafe movement, right? That's all funded through federal and state monies. All of those things, and the opioid settlement monies, all of those things would stop. And because now we're just in survival mode, we just got to try to keep the programs that we've got going. And that would be such a tragedy.
Yes. So instead of growth and implementation of new things that you've been wanting to do, we hope you're able to just maintain, right?
Correct. And I'm not sure we could even maintain, because I don't think there's enough opioid settlement money to even maintain the system in the way it is. I mean, they're talking about 1.6 billion people. So 2 billion people were getting substance use treatment through Medicaid last year, and they're saying that would be reduced by 1.6 billion. So only 400,000 people were going to, in our state. So now what we end up doing is saying, okay, we have all these people that can't get treatment, and we have organizations like Next Step that have to shrink and become volunteer. So they're gonna lose services that they desperately need, like clinical mental health services. So they're gonna go back to what we used to call halfway houses, right? Alcohol and drug halfway house. Just go there and hopefully you're gonna get clean, versus going somewhere where we know you can get recovery, not just stay clean, but get recovery.
The people that you serve, we see walking down the street, we have no idea that they may be in a program like this.
Correct.
That they're using these services. They just look like everybody else.
Well, they are everybody else. Addiction is an equal opportunity destroyer. It does not care about race or class or economics, or, it will affect any family anywhere. And today, we call it an epidemic because it is an epidemic. These young kids that are coming up, the way that social media is even created is to get to that addictive part of your brain. That's why people scroll for hours, because there's this intermittent reward and the way the algorithms are made. So everything in our immediate gratification society feeds addiction. You can get shipped something in one day, so this idea of I want it, I get it, I want it, that's an addict brain. And it's that part of our brain gets triggered. And now you add on to that availability of drugs. You're in a neighborhood, your mom and dad are using, your cousin, there's no way out except to have literally get a treatment community that actually is going to take you out of that community and work with you. So that's the part that's pretty scary, is we're going to need more recovery communities, not less, because it is so prevalent. And people can tell you it's people that have had a loved one or have gone through it themselves. People in recovery are the most courageous people I've ever met. What they have to do every day, it's incurable. This is not a curable disease. It is a manageable one. It's chronic. They're always going to have it, like diabetes. It can be managed, but to manage it every single day is so difficult. And we should be giving them a standing ovation instead of stigmatizing them, because it's a hard journey. It is a hard journey. Every day they have to make the decision to face life on life's terms. And that's why it is a spiritual journey. That's why it's hard to do this on your own willpower. In fact, I'm not going to say hard. It's impossible. It's impossible to do it on your own willpower. which is why the 12 steps are the 12 steps, right? I surrender.
Mm-hmm.
I come to believe a power greater than myself can restore me. I turn my life and my care, my life and my will over to the care of God. 1, 2, 3. Those are the first 3 steps. I can't do it.
Mm-hmm.
He can. I think I'm going to let him. So that takes a long, that just takes connection and people take resources. And the people, I wish I could pay my people more than I pay them. Medicaid does not reimburse at a very high rate. And so, we're on a shoestring as it is, trying to pay our people the way that they really deserve to be paid. And so you cut that out from under us, and you cut out our ability to help people.
So you have told us a lot today, and we're all so appreciative of the work that you and other people in your field do. And it's so dependent upon this Medicaid and these
Yeah.
grants. And you've told us what happens if Medicaid goes away. So are there other thoughts that you feel are important to our listeners?
Well, I think the other thing that I would say is important is to understand untreated addiction is going to affect everyone. Because now if I'm not treated and I'm still out there, I'm going to be a criminal. I'm going to steal to get my fix. I'm going to be breaking, it's untreated addiction will be a societal war, right? It will affect everybody. So this is not well, I'm not an addict or I don't know an addict. It doesn't affect me. Yeah, it does, because it affects all of us, because the healthier our society is, the healthier we all are. So I think everybody understanding the importance of Medicaid to this particular population, there's many populations that Medicaid is important to, not just mine, but behavioral health, mental health, addiction is a huge area. People that work and have commercial insurance, private insurance through their employer, they're going to go get addiction treatment. They're going to go stay at Malibu Passages or nice addiction treatment centers that are paid way more than Medicaid pays. I mean, commercial insurance pays several $1,000s a day for you to go get treatment. And Medicaid pays a few $100s a day. So it's not even close in terms of the different. So those people will always get treatment. So who's not going to get it under this bill? Who's not going to get health care? The poor people, right? The people, 138% of the federal poverty level is the cutoff for Medicaid in the expanded Medicaid states. So in this state, that's $15,570. If you make under $15,000, you are eligible for Medicaid. That doesn't seem like, it seems to me like that's fair. If you're only making 15,000, how are you supposed to be able to pay for your own insurance? It's not possible, even if you're employed. So I think, listeners need to understand that protecting Medicaid protects lives. It protects livelihoods of people in the workforce that are doing the right things, that are doing what everybody wants them to do, working, giving back. Protecting Medicaid protects not only people's lives, but those livelihoods of all those healthcare workers that have worked so hard to be where they are. So it's an important issue for all of us.
Well, it certainly is. And I ask our listeners to sit and think about the families that they know who have, as you said, Dana, it's not just addiction, it's the mental health part that goes with it, because and when people are talking about mental health services not being available, that very much affects you as well. And that's Medicaid.
Yes.
We have ADHD can have treatment, right?
Yes. Absolutely.
Any number.
All of the underlying addiction, all of the underlying mental health conditions, ADHD, bipolar, right? Manic, depressive.
Yes.
They're going to go find a way to treat that, because it's not fun to live with a mood disorder. So they will smoke pot because that brings them down, or they'll take a Xanax because that helps their anxiety, and then they'll take another Xanax and then 20 Xanax. And the next thing you know, they're addicted to benzos, right? Or so mental health, the Diagnostic Statistical Manual of Mental Health Diagnostic, right? All that way, big giant book, all the diagnoses. Substance use disorder is one of those. So why we separate them and say mental health and addiction? No, addiction is mental health. It's a mental health condition, but we think of them as different buckets. We shouldn't. It's all the same, right? it's a substance use disorder, is a mental health disorder. And typically we call it dual diagnosis because they'll have bipolar or they'll have depression or they'll have anxiety and they use a substance to try to deal with it, which then brings more problems. So it is behavioral health that we have that is 60% funded by Medicaid. So when that goes away and we throw all this to the wind, we are now looking at what are we doing? Opening up more state hospitals, institutionalizing these people. What are we doing? Because I'll tell you, the drug dealer is still going to be there. The drug dealer,
Yes.
this is high times for the drug dealer because
Yes.
they know how to make money off of people's misery.
Right. Narcan.
Yes.
What Narcan would be affected by this? Now, that's a life-saving. A lot of people don't know about Narcan. Can you tell us about that?
Yeah, Narcan is an amazing discovery. It's a drug, it's a reversal drug. When a police officer would be called to somewhere where someone has, what opioids do is depress the central nervous system. And so you stop breathing if you have too much of it. And so if somebody comes and they have Narcan, if a family member has Narcan, we have we call it a nalox box out in front of our church, our headquarters. And anybody can come and get Narcan for free. We just leave the box on there. They open it up. They get a thing of Narcan. It goes up the nose. It's just an inhaler. And it immediately reverses the opioid effect. So literally, it saves their life. It reverses the fact that they're not breathing and they come back to life. It is I don't even know how many counts. Most of our people have been Narcaned back to life multiple times if they are opioid addicts. So to do, again, that's where we've made great progress in the Narcan that we distribute for free, we get for free because of the grants and because of all the money that's been poured into fighting the opioid epidemic. So our nalox box is going to go away. So now nobody will have access to Narcan. You could actually walk into a pharmacy and get some, right? So because they've made it available to fight this. All the police have it, the fire have it. So yes, this also addresses let's stop spending money on Narcan. How ridiculous. Like what are you saving? I don't understand. I don't understand the logic.
When I was reading about that, I read a story about this couple whose daughter is a user, and dad carries Narcan in his suit pocket and mother carries it in her purse.
Yes, absolutely. All our staff has it on hand. We have it in all of our houses, because they know that's going to, and even our people that are opioid users, they carry it because they have Narcan, their significant other. They have it as a safety mechanism for each other because they don't know what's in the drug. Because it's cut with fentanyl, they might take their normal dose and suddenly stop breathing because there was some fentanyl in there that they didn't know about. And if their partner has Narcan, then they can reverse that. It reverses the effect of the narcotic. So I don't understand why you would cut out that. Why would you stop that? It's this crazy.
So the first step that we should take is a phone call to our elected officials. Is that right?
Absolutely. In fact, I think what we should all be doing is having our morning coffee every morning and then making a phone call. And every morning, that's just our routine. Coffee, call. Coffee, that's what I'm doing every day. Coffee, call, right? Because again, it's the power of the people. The more people that are calling these senators and House, because it's going to go back to the House, calling their representatives and saying, it does not make sense to cut out health care for the poor while you're compensating with the rich, right? You're doing that so that you can keep this $2 trillion in tax cuts in place. How ridiculous is that? So at what price are you giving these tax breaks out? And so they just need to hear, and I believe in the power of the people. I think if we raise our voices, we almost lost the Affordable Care Act in 2017. Without John McCain voting no, we would have been facing this kind of a drastic cut in 2017 because they were going to do away with the Affordable Care Act. So it can really, 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 truly, it can make a difference if we just have coffee and make a call until they just get sick of us saying, please, please, please don't do this. It makes no sense.
So you're telling us that it doesn't matter if we've called once, we can call again.
Absolutely. I call every day, every morning.
Day.
Every morning. I got all the numbers on speed dial. And the little interns that answer the phone, they know me, right? I'm not calling again. Just want to let them know. Because every day there's another provision. They're rolling out, like this Senate bill is way worse than the Republican bill was. The one that was passed by the House, the Senate bill is worse in terms
That's
of what
what I
it does to Medicaid. So every day they're rolling out some new things where the Office of Management and Budget hasn't even been able to interpret how bad it is. And so every day we can make a call. Hey, I heard they now want to do this. I'm absolutely opposed to that. To tell the senator this is why. And every day just call them. Say, I'm just calling to remind you, right? It's me again. And telling other people to do the same thing, because in those calls make a difference. They really do make a difference. These guys care about their job, these guys and gals, but mainly guys.
That's our first call to action now.
Yes.
I can't thank you enough on behalf of our listeners and our whole JUSTus community. This has been so informative. Thank you, JUSTus listeners, for sharing this time and space with us today. And we hope you're inspired to make that call, and by everything that you've learned from Dana.
I would say one more thing, Jane.
Yes.
Which is, get to know the local providers in your community that are providing mental health and addiction services. There's a lot of nonprofits like ours. I can guarantee you in most communities now, there is a recovery community. There's a recovery cafe where you can volunteer. There's recovery, and they're called recovery cafes, or there's recovery communities that are nonprofit, typically faith-based. Get to know those little organizations, because those are the ones that are going to need you. If this bill passes, they're going to need lots of help with volunteer labor so that we can continue to serve the people. That the addiction isn't going to go away. And so we need to continue to serve those people that are suffering. And we're going to need help from other people that have a heart for this particular population. So I would also encourage people to get to know their local recovery community and mental health providers, because they're going to need you.
Well, thank you, Dana. And I agree, we're going to have to step up more and more. So we hope you've all learned a lot from this episode. I know I certainly have. And share it with others. And leave your comments and reviews and any suggestions you have at www.spsmw.org. I almost hate to end this.
Well, thank you so much. And thank you for the work you do, and for the community, the listeners, for caring. That if we stay in this together, we all continue to support each other, we'll get through this. But thank you for doing the work. Thank you for compassionate, caring, service-oriented organization. Really appreciate the Sisters of Providence and the Providence Associates and everybody who's trying to do the right thing, which is love those people that need love and help make our world a better place.
And those of you who live near Terre Haute, find out where Next Step is. Right?
That's right. Come see us at the Recovery Cafe. Join us for a meal. It's free Tuesdays, Fridays, and Saturdays.
All right. Well, we're now ready to make a difference within our community. And if not now, tell me when. JUSTus is a production of the Sisters of Providence of St. Mary of the Woods. Our producers are Jane Fisher and Susie Ray. Our associate producers are Dr. Perlette Springer, Sister Barbara Batista, and Sister Emily Tukolsky. Please remember to visit www.spsmw.org/justus to leave your comments and reviews. And please share this podcast with your friends and your family. Talk with you soon.